Hi guys, welcome back to Eduate channel. So today in this video, we will be dealing with the methods of clinical examination. We all are following some clinical examination protocols. So if at all you have missed any one of these, you should also remember those things and you should always keep it in your mind whenever you are going for a clinical examination. So please subscribe this channel and hit the bell button for more updates. So what to do before examining a patient? So before you are going to examine a patient for the diagnosis and treatment, you should refer or you should find which species it is, breed, age, sex, color, management practices like stall feeding, grazing, etc., prevalence of certain disease according to the geographic location by parasitic disease or vector-borne disease, etc., soil micronutrient status to rule out the deficiency disease, plant poisoning, and toxicity, etc. So next is inspection of different body parts. Head, abdomen, external genitalia, udder, nasal region, ear, abdomen, external genitalia, udder, nasal region, ear region. We should actually see and inspect all these regions for any other malpositionings, any small wounds, any problems with the normal look of these portions. So now recording of rectal temperature. So we should actually record the body temperature. So the best option is the rectal temperature. So whenever an animal is having any problem with the temperature or any internal problems, the temperature will be high compared to the normal. So high fever is the first sign of the most diseases. So we have to check for the fever. So these are actually the normal rectal temperature ranges. You can get a screenshot. So next is the recording of the pulse rate. So we need to know about the cardiac rhythm and the expansion of our heart. So we need to know the pulse rate. So the site for recording the pulse is in cattle is middle coccygeal artery, ventral coccygeal artery under the tail and all. So in case of calf, you can use the femoral arteries. So dog, femoral artery on the inside of the thigh. Next is the recording of the respiration rate. So in cattle, the average respiration rate will be 12 to 16 per minute. So if at all there is any variation in the respiratory rate, that indicates a problem with the respiration or the abdominal jerky or the intercostal problems. We can suspect for secondary respiratory disease due to cardiac involvement and all. This is actually the resting respiratory rates. Next is the examination of visible mucous membrane. We should actually examine the conjunctiva, buccal membrane, nasal membrane, vulval, vaginal, rectal mucosa and all. So we can know the health status of the animal. So in case of babesiosis or the tick-borne hemolytic diseases of dogs, first we will be actually looking the conjunctiva and the buccal and the vulval region. So we can check for the anemic condition. So this is actually the congestion, paleness, pinpoint petechial hemorrhages and all. So cyanotic changes, that means it has got some cyanide poisoning and all. So pinkish, it has got some equine infectious anemia. So ulcerations that will be mainly seen in FMD, PPR and rinderpest, etc. So paleness that can reveal anemia, internal hemorrhage, shock, hypoproteinemia, etc. Next is the examination of eyes. You can go for ophthalmic examination, which will be giving us some clues for the diagnosis. Next is the sunken appearance, papillary reflex, dilatation of pupil, which is mainly seen in the poisoning, opioid poisoning and the shocks and all. So pupillary reflex, if at all any problem with the CNS or the toxemia or shock has happened, it may lead to false pupillary reflex. Corneal opacity ulcers in case of canine distemper and canine hepatitis. This is actually the normal color of conjunctiva of various animals. You can just have a screenshot and you should always remember it. Next is the palpation techniques. You can actually palpate the internal organs, whether the animal has got any hepatomegaly, whether it has got any splenomegaly, whether it's actually cold and painless fluctuating, whether the gas formation is present in the body, whether fluid ascites is there, whether crepitating sound like that of black water, or distended with the gas, that is a bloat or food impaction and all. You can also, through rectal palpation, you can see for the urogenital organs and the abdominal abnormalities. Next is actually the percussion, which is very important case of tympanic membrane and the blood. Auscultation you can use for the stethoscope, and you can use for the pathological condition of lungs, pleura and all. So you can actually hear the respiratory failure sounds and all, or the third murmur. Next, you can go for urine properties. You can check actually the color of urine, normal urine, and you can compare with the animal's urine. Then go for shaking of urine. If at all it's more shaky, that means it has got some pathogenesis. If at all there is a typical smell for the urine, it has got some pathological condition. And go for the ketone body test and all. So if at all the specific gravity is very much increased, means that has got some pathological conditions. So thank you guys.